from the veterinary medicine point of view, what are the effects of stress for you and I? And the first thing to remember, of course, is that stress starts before the cat even leaves its home to come to your clinic. So as soon as the owner brings that cat carrier out, and sometimes I think as soon as the cat hears the owner make the appointment on the phone, the stress starts. So this picture on the left there, I think, just says it all. There's the cat in the car saying, we're all going to die. The dog says, yay, they're really happy, let's go in the car. And the cat says, no, we are all going to die. So just getting into the carrier, getting into the car is stressful for the cat. And then by the time they get into our waiting room, they're in an unfamiliar place. There are predators sitting next to them. So these are all the things that we need to think about and realize that stress is starting before they even reach our exam room. So there's some nice data that was published just back in 2011, actually quantifying the effects on vital signs, what happens when cats come to the clinic. And this was based on 30 cats that were owned by students and staff at Colorado State University. And these cats were examined, and these vital signs were recorded first at home and then in the clinic in the same day. And so what you can see in this chart is the median values for blood pressure, rectal temperature, heart rate, and respiratory rate recorded first at home and then later the same day in the clinic. And then in the far right column is the maximum change recorded, the difference between the value recorded at home versus the value recorded in the clinic. So the maximum difference in blood pressure, systolic blood pressure, for example, was as much as 31 millimeters of mercury. So that we'll talk a little bit more about white coat hypertension in a minute. Rectal temperature can increase as much as 2 degrees. Heart rate as much as 76 beats per minute. And respiratory rate as much as 100. That's a huge increase in respiratory rate, huge maximum change. So these physiologic parameters are highly changeable when cats come into the clinic, and of course that can confound our evaluation of them. Are they really hypertensive or not? Do they have a fever or not? These are things that we all get used to trying to understand in our patients.